Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Gastric cancer, also known as stomach cancer, is a disease where malignant cells form in the lining of the stomach. This type of cancer can develop in any part of the stomach and may spread to other parts of the body, including the esophagus, liver, lungs, and lymph nodes. It's a serious condition that often doesn't show symptoms in its early stages, making it difficult to detect early on. Symptoms, when they do appear, can be vague and easily mistaken for other common stomach issues, such as indigestion or heartburn. This essay aims to shed light on the causes, symptoms, diagnosis, prevention, and treatment of this silent threat. Understanding these aspects can help in recognizing the disease early and seeking timely medical intervention. Early detection is crucial for successful treatment. Methods such as endoscopy, biopsy, and imaging tests are often used to diagnose gastric cancer. The earlier the cancer is detected, the better the chances of successful treatment and recovery. Understanding the risk factors and recognizing potential warning signs can make a significant difference. Risk factors include a family history of gastric cancer, smoking, certain dietary habits, and infections like Helicobacter pylori. While this essay provides valuable information, it's essential to consult with a healthcare professional for personalized advice. They can offer guidance tailored to your specific health needs and risk factors. Remember, knowledge is power when it comes to your health. Staying informed about gastric cancer can empower you to make better health decisions and seek medical help when necessary. By understanding gastric cancer, you can take proactive steps to protect yourself and your loved ones. This includes adopting a healthy lifestyle, being aware of the symptoms, and undergoing regular medical checkups if you are at risk. The exact causes of gastric cancer are not fully understood, but several factors increase your risk. Understanding these factors can help in early detection and prevention. Your diet plays a significant role in your overall health and can influence your risk of developing gastric cancer. A diet high in salty, smoked, and processed foods, while low in fruits and vegetables, can increase your chances. Consuming fresh produce, whole grains, and lean proteins is recommended. Certain infections, like Helicobacter pylori, can also contribute to the development of gastric cancer. This bacterium is quite common and can cause chronic inflammation. This common bacterium infects the stomach lining and is linked to an increased risk of the disease. Treating this infection early can reduce your risk. Genetics also play a role in the likelihood of developing gastric cancer. If you have a family history of gastric cancer, you may be at a higher risk. Genetic counseling and regular screenings are advisable. Other risk factors include smoking, excessive alcohol consumption, and certain lifestyle choices. Long-term inflammation of the stomach, often due to chronic conditions, can also elevate your risk. Regular medical checkups and a healthy lifestyle can help mitigate these risks. Gastric cancer often doesn't cause noticeable symptoms in its early stages. As the tumor grows, it can cause a range of symptoms. It's important to remember that these symptoms can also be caused by other, less serious conditions. However, if you experience any of these symptoms persistently, it's essential to consult a doctor for a proper diagnosis. Common symptoms include persistent indigestion or heartburn, feeling full after eating small amounts of food, nausea and vomiting, unexplained weight loss, and abdominal pain. Other potential signs include difficulty swallowing, blood in the stool or vomit, fatigue, and anemia. Section 4. Detecting the silent enemy. Diagnosis of gastric cancer. Gastric cancer, often referred to as stomach cancer, can be challenging to detect in its early stages due to subtle symptoms. Diagnosing gastric cancer usually involves a combination of tests and procedures. These tests are designed to provide a comprehensive view of the patient's condition. Your doctor will start by taking your medical history and performing a physical exam. This initial step helps in identifying any risk factors or symptoms that might suggest the presence of gastric cancer. If gastric cancer is suspected, further investigations will be necessary. These additional tests are crucial for confirming the diagnosis and understanding the extent of the disease. Endoscopy is a key diagnostic tool. This procedure allows doctors to get a direct view of the stomach lining. This procedure involves inserting a thin, flexible tube with a camera into the stomach to visually examine the lining and take biopsies. The images captured can reveal abnormalities that might not be visible through other tests. Biopsies are then examined under a microscope to check for cancerous cells. This microscopic examination is essential for confirming the presence of cancer and determining its type. Imaging tests, such as CT scans, MRI scans, provide detailed pictures of the stomach and surrounding organs. And PET scans can help determine the size and spread of the cancer. These imaging tests are vital for staging the cancer, which guides treatment decisions and helps predict the patient's prognosis. Section 5. Shielding your stomach prevention strategies. While it's impossible to completely eliminate the risk of gastric cancer, there are several things you can do to reduce your chances of developing the disease. Making healthy lifestyle choices is paramount. Adopt a balanced diet rich in fruits, vegetables, and whole grains. Limit your intake of salty, smoked, and processed foods. Quit smoking and avoid excessive alcohol consumption. If you have a family history of gastric cancer or other risk factors, talk to your doctor about regular screenings. Early detection is crucial for successful treatment, so don't hesitate to seek medical attention if you experience any persistent symptoms. UMCC, your ultimate medical consultant connector.